Hi, I'm Dr. Isiorho, Dr. I. We have a procedure today, and unfortunately, a foot has stepped on something foreign. So, if you want, you can actually come over here and you can see the object. We have a lesion marker right there, and then you can actually see the actual foreign material. Now, we're actually going to look to see if we can find this material under ultrasound. So we already have our patient numbed and prepped. We did not prep the ultrasound area because we're going to use some ultrasound gel, and we're actually going to look at that later. And out of habit, I'm going to call you my dear, so I don't say your name. So I apologize. So now that we have our coupling gel on, we put our probe on, and if you look at the ultrasound, we'll be able to see that foreign body coming in around this area, because we see something linear or straight in the foot and the toe. We don't normally see straight items in the feet, so move your toe up and down a little bit. Can you feel that okay, my dear?
Yeah, I really don't feel much.
No pain. Good. That's what we want to hear. And that's the area where we're going to be going to. So you can pause that. So now we're actually going to try to remove those pieces of foreign body from our patient's foot. So this part's the graphic portion. So if you don't like blood and guts, turn away. I'll turn away too. So you can see the area where they actually have the penetration. And with our foreign body marker, I know where to look at to get that lesion out. You doing okay up there?
Yeah.
Okay. We actually can feel some of that hardware as well too, so I'm getting some of it out already. I'll put these right here. So was there broken glass on the ground, or what? How did this?
I have no idea what it was.
You have children though, right?
Yeah.
There you go. Blame the children.
We have not dropped any glass. I tried looking for broken glass. That's why I thought it was in my foot, because I found nothing.
What about that puppy?
It totally could have been the puppy. She certainly brings things everywhere.
Yeah, I can feel it right there. The good thing about this is when it's early, you don't really have to worry about it being encapsulated with too much tissue. A lot of times I'll find patients come in when it's later and they've stepped on the glass. They don't recall stepping on any glass, but they recall having some pain to the area. And it actually scars up and makes it a little bit harder, or gets it more entrapped or encapsulated within a soft tissue. So it's a larger procedure for us. Yeah, there's a lot of particles in here. I'm trying to pull one large piece out, but we're piecemealing it. Still doing okay?
Yeah.
All right. So we got all the portions down here out. There's one little portion up here that I'm still filling. Yeah, there it is. You can hear it? Yeah. All right, my dear. Almost there. Feeling any pressure?
If I didn't know it was happening, I'd feel it'd be nothing.
Good. That's what we want to hear. We got the good stuff.
Yeah.
Sometimes we get you to knock off, but in these uncertain times, we're going to give you the good stuff.
I can tell.
So now I can actually visually inspect and see. I don't see any more foreign objects in there. Now we're going to feel. You guys have heard me say this already. There it is. The enemy of good is better. So let's get more better. Voila. We'll find that later. But we got that large piece out. Now it's satisfying. Make sure there's nothing else in here. So my dear, we are actually going to put one stitch in your foot, on the bottom of your foot. We're going to give you a post-op shoe. We're going to clean this out. Get you back on your feet so you can be momming again. Yay. To all the mothers out there, we can heal you. Pause in a second. So there is the foreign piece right there. Glass.
Play.
Okay. So now that we got that material out, we're just going to flush and flush and flush and flush. This is a dilute solution of betadine. And yes, my staff hates me because I make a mess. But just helps to clean out anything that may be inside that area that's dirty and we don't like it. When you have a wound or puncture lesion on the bottom of your foot, you're prone for tetanus. So that's the next thing we're going to ask is, when's your last time you've had a tetanus shot or a Tdap or a booster?
A while.
How old's your youngest child?
7.
7. So most likely you've had it in the past 10 years. You usually get those when you're pregnant. Now that I've made a satisfactory mess, I'm going to close it up. Looks nice and clean. We inspect again, make sure there's no foreign body one last time. I don't feel anything, I don't hear anything. Huzzah! Pause it, please. So now we're just going to put 1 or 2 simple stitches in here to kind of reapproximate everything that we've just done. He's going to stay in for about 10 to 14 days. We'll have the patient come back in and take it out. Now, we're going to put all these fancy dressings on her foot. Vaseline impregnated gauze. Regular old fancy, non-fancy gauze. A couple in between your toes. And if it gets too tight, my dear, you let me know, okay?
Okay. I might not know for a few hours though.
I know. I'll be getting a text later on. What did you do to my wife's foot? She came to me.
It's a lot better than what he was trying to do last night.
So don't be surprised if your fourth and fifth little toe remain white a little bit longer. We did put some epinephrine in there, so it will make the blood not come back as well. But the other great thing about the epinephrine is that it also helps with the numbing. It keeps it numb a little bit while longer. So you are right. It was around 11 o'clock when we gave you that medication, so right around midnight.
Okay.
So I would suggest you take at least some ibuprofen or Relieve or some sort of NSAID
Okay.
with your dinner tonight, just to kind of stay ahead of the pain.
Okay.
And then last but not least, a little ACE. And again, if something happens over the next week or 7 to 10 days, you can always change or adjust the ACE wrap. If you want to or need to, you can adjust this wrapping and this dressing. But if you can keep it clean, dry, and intact until you see me in 7 to 10 days, you should be able to make do. We'll give you a post-op show as well too. So, foreign body removal, it doesn't have to be the end of the world. We can take care of you. Take care.